Hi, I'm Dan Baker from Helping Hands. I do a lot of grief recovery programs for CMHA in Moncton. So I put out a video on grief and COVID-19. So I'm here tonight to answer some questions or to have discussions with people in regards to this. So if you have questions, I'm all ears. Actually, I'm all headphones. And then behind me, you see my hat. So I'm a man who wears many hats. Or that's what I've been told anyway. So I put a video out a few weeks ago that's been on the CMHA New Brunswick YouTube video site. And I talked a lot about COVID-19 and grief recovery and why did I think that this was related to grief. And I talked a little bit about the fact that, grief, a lot of times people think that grief is just related to death, and can people hear me? Yeah, okay, yeah, but it's not. It's anything that's changed in a person's life that's familiar and that you hold emotionally significant. So that covers an awful lot of things, an awful lot of losses in relationships and losses in familiar patterns of behavior. And death of course is one of those significant losses, but so is this COVID-19. This is a huge change that's happened to millions and millions of people right around the world, with sheltering in place and social isolation and quarantine, and then all of the kinds of repercussions that dealing with this pandemic has had on people. It's really turned everything upside down for everybody, myself included. So there are a lot of emotional tags to this experience. And so the message that I wanted to give out in the video was that whatever it is that a person is feeling as a result of the experiences that they're going through, that it's completely normal. And in fact, that's whatever an individual is experiencing, that's what that individual is experiencing, and that's the unique to them. Because despite the fact that millions of people are going through this all across the planet, your situation is unique, and so is the next person and the next person. And so you can't lump all of this together and say, oh, we all feel the same way, because we don't. There's a lot of conflicting feelings about COVID-19 and the impact it's had on us. We might have been directly impacted and touched. Here in New Brunswick, we're quite fortunate. Actually, today I've heard the results that we're a number of days now without any new cases and no deaths. And so I think somewhere I heard that this is the safest place in North America. So we've done a pretty good job, but that, even despite the fact that we've done a pretty good job in keeping everything kind of contained, it still has had a huge impact on people's well-being, their mental health, their physical well-being, their emotional, their social connections with other people. So I'm going to look at some of the in the chat. It says from Sheena, I imagine it must be hard to grieve with all that is going on right now. You can't have a proper funeral, you can't hug someone. And you're right. You're absolutely right. It is unprecedented that we can't even have those kinds of ritual experiences, for sure. But you can still grieve. And regardless of whether or not you can go to a funeral, you're still going to grieve. The funeral part of things is the ritual experience that we have in order to draw some kinds of conclusions to the end of a relationship. And those kinds of rituals are very important. Those are the kinds of things that we can't have, which makes it even more difficult. But the relationship that you've had with an individual, you still grieve individually. It's not going to the funeral, and it's not going to the funeral home. Those are parts of a ritualistic experience. But the grieving part of it is something that an individual does with themselves. And in the grief recovery programs that I run at CMHA in Moncton, we talk about the importance of emotional communication, and oftentimes, in many cases, when an individual dies, that they're left with emotionally unfinished business, which, for example, if someone is in a nursing home and you haven't been able to see them and you haven't been able to go and visit them, and they've been sick and you haven't been able to go and comfort them, and you haven't been able to go after they've died, and you haven't had the opportunity to emotionally complete your relationship with that individual, to be able to say all of the heartfelt things, to be able to share with that individual, to have that person share with you. And so we're the ones that are left emotionally incomplete. And that's the kind of thing that I end up doing with people, is to help them to discover and to do the emotional completion work, which is also very much a part of the grieving experience, which is often left unattended. You could go to a funeral and have all of that ritualistic experience, but still not have that aspect of the emotional completion of finishing that emotional communication with the person that you've lost. So that makes it doubly difficult for individuals. But in the programs that I run, there are opportunities for people to be able to discover and do that in a safe and non-judgmental way. And yeah, this has presented some interesting challenges for this kind of work, for sure. And I've met a lot of people over the years, and sometimes those individuals that come to the programs, they haven't had the opportunity to have a last hug or to even attend a funeral because their loved one died in a plane crash and they were never to be seen again. So it's the ritual part of it is important, but it's not the only thing. And in fact, the emotional part is probably even more important. And I often tell people that it's really important to discover all of the emotional content that an individual has. And I know that from the experiences that I've had, is that a lot of times we're denied, or we're not encouraged to be truthful and honest about how we feel around certain situations. And that part of that is, it can lead to some unresolved information, unresolved in our hearts about what's important to recover from. I'll give you an example. My closest friend died, which is the reason why I ended up starting to do this in the first place, but I didn't get a chance to say goodbye to him, and I had made a promise that I wouldn't let him die alone. And he ended up dying when I went to get something to eat, and I was angry with him, and I was sad that I was regretful. I was relieved that he died because he was suffering, so I have all these conflicting emotional feelings. And sometimes if I try to tell people about some of those feelings, they tell me, don't feel that way. You don't have to feel that way. You can do, you don't feel bad. It's not your fault. Or, hey, he's in a better place. And, and all it does is it denies me from the truth of what I'm actually really feeling. So I think for the most part, even though you can't go to a funeral or you can't go to the ritualistic experience that we have, is to really understand the emotional connections that we have with people and the relationship that we have with people, and to really be honest about all of that stuff with an individual. Now, this is my first time, so I think it's going to take me a little while to do. I got Q&A up here. I got questions. So, Sheena, I know I can go on and on. Just this is really difficult for me, because if we were face to face, you could jump in and have this conversation. But I suppose you could do that as well too. So I hope I answered your question. So I'm going to look at some of the other questions. One's from Melissa. Do you think that mental health for essential workers will be affected in any way, as well as people who will be going back to work but have been off? Yeah, absolutely, for sure. Do I think mental health essential workers are affected in any way? Yes. My daughter is a ICU nurse, and she's on her way to work in the ICU in Halifax. And Halifax has had some cases. Most of those cases have been related to nursing homes. But when I think about the individuals that have to make life and death situation decisions for individuals, or who are worried about whether or not they've got enough personal protective equipment, or whether or not they are going to be exposed to the virus, or whether they're going to expose somebody else to the virus. Yes, absolutely. I think to say it's a huge preoccupation for sure. It's a dangerous field. Essential workers are putting themselves on the line. And that's from the person that's working at the grocery store, you know, who's cleaning the carts, to having people coming in, whether they're respectful or not respectful of social distancing and hand washing and wearing a mask or not wearing a mask. So yes, absolutely. And do I think it's going to be difficult for people when they go back to work, or if and when that's going to happen? And I'm not even sure how that's going to happen. But yeah, I think, yes, for sure. I think this is a very different world now. And we are not going back to what we thought was normal. It's a new normal, and it can be a very challenging time. So I guess the way that I like to look at this is three things. One is identifying for us what's changed as individuals. So the kinds of, so if I look at myself, what's changed? Well, the familiar patterns of behavior that I have, or that my wife and I have changed dramatically. Grocery shopping, those kinds of things. We can't just sort of go out and do that whenever we want. I'm a big woodworker, so I can't go out and buy wood and, rummage through the lumber yards and, mill about and looking at tools at Home Depot. I can't do those things anymore. So I have to find other things to do. So if I identify all of the changes that I'm experiencing in my life, then I have to look at what challenges am I going to face as a result of those changes. I can't see my family. We haven't seen my in-laws, my brothers and sisters. And we're a big family, and we're a big gathering. So, and then the third thing would be, what choices do I have? What choices can I make? So when I look at the changes and then the challenges, and then I have to look at the choices. So in grief recovery, the workshops I do, I always talk to people, about reclaiming your life. And that's really difficult. And the changes and challenges and now choices are forcing me to do things where I have to reclaim my life. And other individuals, all of us are going to have to do those kinds of things. And if we don't have the skill sets or the resources or the tools to be able to do those, we've got to get those. And that's one of the reasons that I'm doing this, is to help people to find the tools to be able to do this. So tonight is just a Q&A kind of thing, and then we'll see where we go from here and how we can help people out. So yes, it's going to be a challenge, and people are going to have to make some different choices in terms of going back to their work and how it affects them. But what I really do want to say is that the most important thing for people to be able to do right now, to be honest about how they feel, is to be truthful about how they feel. I mentioned in the video, Fred Rogers talked to kids about feelings a lot. And one of the things that he said was, anything that happens to a human should be mentionable, and anything mentionable is manageable. So if we don't mention it, we can't manage it. So at least we've got to start by talking about it. So we'll start from there. Hopefully that helped. Deborah, my sister-in-law's brother died, and only 5 people at the funeral. My brother could not go. Getting together was awkward. Talking through a window, no hugs, so empty. Yeah. I'm very sorry. Yeah, I'm very sorry for your loss, and I wish I could say something that would be helpful for you. It's difficult, very difficult. But one of the things that I would recommend to people, which I recommended in the video and I recommended in the handout that I had, was to get a copy of the Grief Recovery Handbook. Grief Recovery Handbook is a very valuable resource, and it's you can get that through Chapters, Amazon, book outlets. Sometimes they have those. They're relatively inexpensive, about $20. I don't have any left because I've given all my books out since all of this started. We were right at the end of a grief recovery program and just about to start a new one, and everything just sort of fell apart. And then I wanted to reach out to help as many people as I could before we weren't able to see anybody because we stopped so immediately. But a grief recovery handbook would be a very helpful resource. And the other handout that I mentioned in the video that went along with that was 61 tips about grief related from the Grief Recovery Method website, in which John James and Russell Friedman had put together a number of years ago, but still applies very much today. And that's a very helpful thing. So there are some resources out there that would help people. In terms of the physical connection, and I can't do anything about that stuff, just like I can't do anything about having a group right now. So, but what I can do is talk to people about what they're feeling. And I think that's probably more important right now than anything else. So, all right, do we have any more? Do we have, okay, this is, was that helpful? This is all, you know, okay, so, you know, it can be senseless when we have to avoid seeing loved ones and even getting used to a new normal. Yeah. Yes, getting a new normal. What a normal, a setting on the dryer, right? Yeah, so not really, doesn't really say much. The only, I tend to kind of shy away from the word normal and say what was familiar. So if what I was doing yesterday was familiar, and who I was with yesterday was familiar, and the people I have in my life is familiar, and that's all changed, well, that's my new normal, you know, it's my new familiar. So, and I'll tell you, we get quite get quite embedded in our familiarities, our routines. And when those things change, they have emotional impacts on us, not just physical impacts, but emotional. Our cognitive behavior changes, our mental health can be affected, our physical health can be affected, our emotional well-being can be affected, all by those kinds of unsettling changes. And this is a huge unsettling change because there's no kind of, well, we don't have a reference point for it. You know, none of us have ever lived through this. The only person that's ever lived through this is, well, 104 years old, and you know, we hear stories from them. Yes, I lived through it when I was a little kid, you know, but we don't have any of those kinds of experiences with something so dramatic as this, and so widespread. Every person on the globe, or you know, and that's the only thing that is normal, is that everybody's experiencing the same thing and in their own unique way. So that's what makes it doubly difficult for individuals. Melissa, I think people who are also single will have a hard time letting someone in. It will be interesting to see what the new normal for the dating culture. Oh, what do you think will happen towards that? Well, okay, let me tell you this. Dating culture. I'm not sure about the dating culture, but my wife and I celebrated our 40th wedding anniversary in April. Yes, but say our celebration was supposed to be in Rome. So we weren't able to do that. So it's a big change for us. So I don't know if I'm the best person to talk about dating culture because I don't know much about it, but I do know about relationships. So what's important? I think there might be an opportunity for people to do quite a bit of discovery in this time of reflection, to find out what is important in their relationships with other people. And one of the things that I've learned about doing grief recovery is that relationships change, and sometimes they can change at the drop of a hat, much like this COVID-19 thing kind of came right around the corner and slapped us into a new reality. Sometimes relationships change. And therefore, one of the things that I suggest to people when they're in relationships or relationships that have ended is, before you get into a new relationship, it might be important for you to do what you need to do in order to complete the relationship that you were in. For example, and I often use this as an example in my grief programs. You fall in love with somebody in grade 5, whatever, and it's, you go home and tell your parents, oh yeah, I'm so in love. And they say, oh, you don't know anything about love. That's just puppy love. And you're all confused. All you know is the hair stands up on the back of your neck and you're in this relationship. And 2 weeks later, it's over. They found somebody else in the playground on the carousel swing and you're heartbroken. And you go home and tell your parents what this is. And they tell you, don't feel bad. There's plenty of fish in the sea. So what we end up having is this replaceable relationships. And that continues. That concept, that idea that we move from one relationship to another relationship, and we drag with us the unfinished businesses of old relationships. And so we get into a new relationship with somebody else, and we still have some of the hurt and pain and the feelings that are residual from the last relationship, and we really haven't done any of the kind of recovery work that we needed to do in order for us to go into the new relationship. And so sometimes 5, 6, 7 relationships later, we're wearing these kinds of bandages over wounds that we've experienced in relationships that we haven't recovered from, and we continue on the path, and it makes it much more difficult for us to really understand what it is that we want in a relationship, because we're vulnerable, we're afraid, we don't want to get hurt again, so therefore our heart closes up, we're not as exposed, we don't show ourselves, we want to be loved, but we don't want to be hurt. And so I always encourage people, before getting into a relationship, you should look at your past relationships and emotionally finish what's in those and take recovery steps to help heal your heart from those kinds of things in order to know what it is that you want to get into next. Because it can be a lifelong kind of pattern of behavior that ends up greatly limiting a person's capacity for happiness. And so when you have a limited capacity for happiness, then you also have a limited capacity for meaningful relationships. And so you really limit the quality of life that you have. So that would be one of the things that I would, strongly encourage before we start. I know we like companionship, and the social participation with people is really important, but the meaningful of the relationship is more important than that. So you really got to know what it is that you want, as opposed to just being with people. There's lots of opportunities for that. Should be included. Okay. I hope that was helpful. I'm not sure if it was, but that was my dating advice. But it's more about relationships, really. This is. Thank you for being so knowledgeable, like a champ. And this is really cool. I'm enjoying. This is new for me, and I'm trying to, because I can see, the only person I can see is Corey. I can see smiling over there, and I can see her, but I can't see anybody else. So it's really hard for me to get kind of the inflections from people. And so one of the things that I talked about in the video that I put up is, one of the things that happens to people when they're grieving is isolation. In fact, we're taught that, if you're going to cry, go to your room. Grieve alone. Suck it up, buttercup. Pull up your bootstraps, move on. Hey, you're still grieving about this. Hey, you're still crying over that. Shouldn't be over this by now. So because we can't talk to people and be truthful and honest with individuals, and because they won't accept our honesty without judgment, we isolate. And so we isolate within ourselves, and we isolate physically. So one of the things that's happened here is that we're forced into a physical isolation. So on top of that, it's doubly difficult now because you're already feeling isolated, that people are physically isolated, where you can't actually just sit with somebody and have an honest to goodness conversation with them. So it's difficult for me to be able to do this kind of thing, but I'll do the best that I can. But one of the things that I can suggest is that in the meantime, there are things that people can and should do, and that's because it's really important. The changes and choices part of this, changes are the challenges that you face because of the changes lead to choices, and the choices then become a level of responsibility that the individual has. And so I don't know if people are going to be able to see this or not. See that little hole there right between, right there? If you have to take at least as much of that responsibility for choices that we get to make. If we don't do that, then we have nothing to work on. It's anybody else's deal and anybody else's fault. But if I feel something, then I have to challenge myself, look at those feelings and say to myself, do I want to continue to feel this way, or do I have choices to feel something else? And what actions do I need to be able to take? So that's the choices. So choices, even in isolation, a person, even though they might feel like they can't get out of bed and can't pull the cover, they just want to pull the cup back over your head. You have to start making a choice to do something, to get active doing something. And so how do you combat isolation when you're being forced to isolate? Well, this is one of those things. We're video chatting and picking up the telephone, that thing that, we used to use all the time instead of texting, but just, reaching out and hearing somebody's voice is much different than getting a text from somebody. And I know a lot of people are very much into the texting, and I'm not making any judgments about that, but there's something about me picking up the phone, calling my brother-in-law and talking to him, hearing his voice, and getting that inflection, just even from the tone of his voice, or my sister-in-law or my sister, hearing their voices. The other thing that are the activities that we do, and there's lots of stuff that I've seen, and some of it is a little crazy. I don't have to worry about cutting my own hair. I've taken care of that years ago, but there are lots of people that are putting up videos about all kinds of things, but some of that stuff is about being actively participating in something. People are homeschooling their kids for the first time, or they're struggling through these challenges and trying to make choices that are good for them. So I can only encourage people to continue to be active, write letters, get your feelings down on paper, have a book club group that you can join, something. But that responsibility, that little spot right there, is the beginning, because it's about our lives. And I am the only one that can reclaim my life, and you are the only one that can reclaim your life. So if that's the case, then I have to do things to start to reclaim my life. And that's what's going to be a challenge for a lot of people when this pandemic thing sort of eases up, and we're all going back to work and going back to school, and we're trying to establish ourselves in this kind of new unfamiliar territory, are taking the responsibilities to reclaim our lives, and whatever that means. And I know that it's not easy, and I'm not suggesting it is, but it's essential that people do that. And if enough people don't have the resources, don't have the tools, don't have the mechanisms to be able to do that, let's put them together. Let's develop them. Let's get them out in people's hands so that they can start talking about those things and doing some things for themselves. I know, like in the grief recovery programs that we ran in Moncton, there have been a lot of people where they've gone through the program and they have been able to reclaim their lives. They have slowly started to put their lives back together again, and it's not a quick fix. There's no pixie dust there. It's hard work, but it is your life, and my life, and I am responsible for my life, regardless of what the situation throws at me. I know it can throw some awful curveballs, because I've had some hard curveballs thrown at me. So, but I know that it's true. And I went through this program. I did not just do this program for other people. I've been through this on the other end. I can't ask somebody to do something I'm not willing or able to do for myself. So I think that's the first rule. You wouldn't take scuba diving lessons from somebody who'd never scuba dived before, or jump out of an airplane with somebody who'd never parachuted before. So I think it's an important starting point. You know, no one saves ourselves but ourselves. Yeah, I like that. Yeah, that's true. No one can and no one may. We ourselves must walk the path. Absolutely. It's our lives. And I know that the things that happen to us can hurt. And I know that if we left hurts unchecked, there's an old expression that hurt leads to hate. And that word that's a strong word to use, hate. But it becomes, when you look at a kind of a broader definition and understanding for it, hurt ends up harming in so many ways your capacity to open your heart, to be able to have relationships with other people, to feel love, to feel a sense of belonging, to feel safe. And therefore it leads us in a direction of isolation, alone in a crowd, not connecting with other people for fear of hurt and how much hurt can. And on top of that, on top of all that, the emotional energy that is redirected out towards other people at a time when you should really be focusing on the hurt that you have inside of you. I'll give you an example. We're pretty quick when we've gone through a hurt to all of a sudden start to assign blame somewhere else. You know, I've worked with lots of people who have, you know, lost someone that they love because of, you know, negligence, an accident, mothers of a drunk driver, you know, those groups. And their energy is focused on the perpetrator of, you know, like, say, the drunk driver. But my question would be, would you miss your son if he died any differently? And let's focus on that first. So let's focus on the actual grief, the pain of losing someone that you love first, before you start generating this cycle of redirected energy towards someone else. And we do that quite quickly. We're very quick to start pointing fingers, and we're very quick to start laying blame. But really, I got to tell you, there's plenty of time for that stuff later on. There's lots of opportunity to ask those really important questions about why this happened, but not while we're grieving. You'll have much more energy to address those kinds of things if you deal with the emotional hurt first than you will if you start focusing it on something else. And that's one of the pitfalls, is that we're taught to distract ourselves, to not think about it. Keep yourself busy. You know, get yourself actively involved in something so you don't have to think about it. Well, I can tell you, you know, I miss my friend. He's been gone for over 20 years, and I still miss him. There are times during this I wish I could sit and have a conversation with him, you know, about what he would say and what we would talk about and those sorts of things. So it's you know, I can keep myself busy all I like. That's not going to change anything. I'm just going to be exhausted at the end of the day. And when I go to put my head down, I'm not going to sleep. I'm going to pass out. But I'm still going to wake up at 3 o'clock in the morning, eyes wide open, thinking about, you know, my loved one or the situation that I'm in. That's not going to make any difference. So why distract ourselves from it? Why not just face it and talk about it truthfully, honestly, openly, and not worry about being judged by it, you know, and then move on to the next feeling. And I'm pretty straightforward with that kind of stuff, you know. You know, I hear people use the term, you know, I regret. You know, yeah, sure, I regret. You know, I could have, I should have. You know, we all have. I wish things had been different, better, and more. We all have that. Coulda, shoulda, woulda. You know, okay. what are the realities of those? What could you have done differently? What should you have done differently? What would you like more of or less of in a relationship? And when you identify those kinds of things, well, let's take some action. You know, the person who feels regret. Well, I did. You know, when I left to get some food and my friend died. You know, I felt like I betrayed him. You know, so I really felt guilty about that until someone asked me, well, did you intend to harm him? Well, no, but okay, well, then let's change the definition of this, you know, wish things had been different, better, more. Yes, I do. So, okay, what would you like to do about that? Well, I'd like to apologize for it. I'm sorry I went to get something to eat. I could have been there with you when you died. I left you alone, you know? And because he died when I left, you know, I was really angry with him. Well, can I forgive him? Sure. Yeah, that's what I need to do. So out of those things come these actionable kinds of things that I can do. So it's really important, you know, to be active, but not at the point of distraction. It's not about distraction. There isn't anything going to distract me. There isn't anything that I could do that would distract me from this virus. This thing is, we're hearing about it all the time. We're seeing about it all the time. It's constantly in our presence. So I could get busy all day long and still it's not distracting for me. I don't want to, I can't not think about it, you know? Okay. Corey, I've got one for you, Dan. Is there an effective way to deal with the grief of more generalized losses? For example, the shootings in Nova Scotia. Wow. Generalized losses? Wow. Wow. Yeah. Well, those are, first of all, those are individuals. They all have lives. And I think that's really important. I think we tend to think of this and clump it all together as this experience. But when we get right down to it, it really is people's lives and those lives that have been impacted and affected. And so how does that translate to us, even though we don't know those individuals? Well, same kind of thing. It becomes almost an intangible thing for us, but a very real. So what it does for us is it directly impacts how we feel about our safety, loss of trust. You know, the very fact that this perpetrator of this terrible crime impersonated an RCMP officer, a person that is supposed to be the safest individual that and sure, yes, if I got pulled over by an RCMP, I would stop for sure. You know, I would, because that's what we're taught, that these are the people that are safe. These are the people that are helpful. These are the people that are pillars in the community that we go to when we need help. And we were deeply offended by the fact that someone perpetrated this crime. And not only did they end up taking lives, they violated our trust and our safety. And I think that's really the kind of thing that we end up having to deal with. Is there are human lives with families and they're affected, and in the proximity is fairly close to us. But really, the losses that we're experiencing are much broader and much more significant for us in terms of trust and safety. And so, do I trust the RCMP? Do I trust? Yes. Yes, I have to. That's the choice that I have to make. I have to get past whether or not this is going to prevent me from experiencing trust. Do I feel safe? Yes, I do. There's crime around me all the time. We hear about it all the time. I think one of the kind of things that happens about this is that we're inundated with it all the time. All the time. It's fresh. It's hammered at us. And that's the media's job. I get it, you know. But I mean, really, how many times do you have to see that jet go into the building in 9/11, you know, really, to fully understand the impact of what had happened? Do you need to see it 15,000 times? No. Do we, you know, the kind of information that we're bombarded with all the time tends to kind of create more and more and more unsettling feelings for us. So I think really we have to take a step back and say, okay, truthfully, honestly, you know, how can I kind of pull this apart? What are the pros and cons of this? How has it affected me individually? How has it changed things for me? What are the challenges that I face, and what are the choices that I get to make? And those are really important things that I end up having to do. Okay, so hopefully that was helpful. The other thing that I um, again goes back to a question that was asked earlier, which is about not being able to have the rites of passage and rituals in order for people to be able to express their companionship with one another in a time of great suffering, you know. So again, hopefully we'll find a way through this and be able to help people through it. But it without a doubt, it's a challenge, and it's going to be difficult for some individuals more than others. Yeah. I'm just going to anonymous. I'm worried about the elderly in nursing homes because they are isolated and don't get to do much right now. I'm sure they are being affected by COVID. They can't be social or see loved ones. What could be something we as a province to do? My poor aunt thinks I hate her because I didn't visit her, but live 4 hours away. That's a good question. My father-in-law's in a nursing home, and we haven't seen him. We've, you know, talked to him on the phone. And that's, you know, about all we can do. We're not going to go and stand outside a window. He's on a 3rd floor. You know, it's not practical or impossible for us. So we tried, you know, all of the members of the family try to keep in touch with him as best as we possibly can. But I know that there are probably protocols in most nursing homes. Even if you sent flowers, they wouldn't get them. They put them in, you know, some kind of deep freeze or isolate them away for, you know, or a book. Like we could even send a book to my father-in-law because he wouldn't get it, you know, puzzles, things like that. So it's a difficult question. I don't have an answer for that other than to, you know, keep her in your heart, you know, as best you can. And hopefully, you know, hopefully she doesn't hate you. You know, you know, and if you feel that way, you know, maybe there are some things that you can do in order to, you know, forgive her for that feeling that she might have, you know, so that you're not so torn up emotionally by the fact that you can't see her and she thinks you've left her out. I don't know really what more I could say to that other than love her in the best way that you can, even if you can't be with her. So find that in your own heart to be able to think of her, to honor her, to, you know, forgive her, apologize to her, whatever, however. Get a copy of the Grief Recovery Handbook. It'll be helpful. It really will. Wait, I got to, there's one more. Is there one more? Does the nursing home offer Facebook or Zoom chats by the recreologist? Hey, no. Yeah, well, you know, I'm not the best person to ask that because this is my first Zoom. Actually, it's not my first. I tried it this afternoon with my sister just so I could see how this thing worked. So, like I said, I've never been a very kind of technological kind of person in this stuff. So this is new for me. And he's 93, so I don't know if he would, you know, I don't know if he would be bothered to Zoom with us. He might think Zoom meant something else. So, but it's an interesting thing, you know. We could certainly try some things. Yeah, for sure. That's the challenge part of this, and the choices that I get to make is that, you know, myself, my father died in November in Ottawa. I live in Moncton, so he was in Ottawa, and my sister lived down the street from him. And I say my father died in November, and I'm fortunate that my father died in November. my father was elderly and not in good health, but not that I was wishing him for it to die, but had he died now, I would not be able to, I wouldn't be able to travel. My sister would have been burdened with everything. I wouldn't have been able to go and say goodbye to him before he died. I would not have been able to do any of the kinds of emotional closures that people would have gotten to do that they can't do now. So I feel very fortunate that I was able to have that experience. And I know that other people have not been able to have that experience. And I'm heartbroken because of the fact that you can't have those kinds of experiences. So in the meantime, I would like to be able to help people find a way to be able to recover from those things, because the recovery part of it is really important for us moving forward in reclaiming our lives. Even though we can't have something now, we can have something maybe a little different later on. So do we have any more questions? Was that helpful? I know all there's retaining iPads to allow for FaceTime, but I'm not sure where the province is in the procurement of distribution. Last call for questions. Yeah, you're amazing. Thank you. Oh, thank you very much, Melissa. Yeah, I hope it's been helpful. What I would like to do, I'm going to talk to CMHA NB. What I would like to do is to put together a series of almost instructional videos related to grief recovery, to go through like I don't want to do a recovery program. That's something that I won't do online. But what I would like to do is to put the components together for people to be able to go. And then if they do have questions, then we could answer those questions, but not do the recovery part. But in the meantime, to give some resources for people to be able to do that. So thank you very much for your time. I really appreciate it, and stay safe, everyone, and happy life.